Welcome, everyone. Today we have Dr. Anchita Bath, who is a physiotherapist and an orthopedic doctor. Her practice is in Devaya Park, and it's called Prakash Physiotherapy. And she's got 11 years of experience in this field. And today she's going to talk to us about recovery and resistance training and a lot of other interesting, subjects. So, welcome, doctor. Yeah.
Welcome.
Yes.
Uh,
Yeah.
my clinic name is Prakash Ortho and Physio Care. There's an orthopedician also.
Okay.
Uh,
Awesome.
so
Mhm.
resistance training and recovery is my
Yeah.
subject today.
Awesome.
Uh,
Awesome.
yeah.
So, yeah.
So
So, I just wanted to
ask me
start
anything.
by asking, what is the most kind of injuries that you see in your clinic when people coming?
There are many types of injuries which are happening nowadays. The
Mm-hmm.
most common is shoulder injuries,
Mm-hmm.
that is the rotator cuff muscles,
Right.
and knee injuries, ACL ligament, and
Okay.
sometimes ankle twisting injuries, that is ligament, the ankle ligament injury.
Shoulder
So the
injuries, that is quite, I thought you would say something like back injuries or something. But why shoulder injuries most a lot?
shoulder injuries is mainly because of not positioning properly while training,
Right.
and you're lifting too much of weight more than your capacity, and you're not
Okay.
giving enough time of rest.
Okay.
So the
So you
muscle
need,
needs a time of around a 5 minutes gap in between lifting two sets. So you should
right,
give a proper gap in between.
right. So
So
it's very important to get a good trainer to watch your technique,
yeah,
I believe, and then listen to your body and to be free of these kind of injuries, right?
yeah,
And what about
yeah.
the knee injuries? What are they caused by?
They are caused by improper footwear technique and landing in on an unequal surface, or you are
Hmm.
landing too forward. So the knee shouldn't go beyond your toe level. You should
When you're
squat
squatting.
properly. Yeah.
Hmm.
If you are not squatting it rightly, then the ACL ligament gets injured. The most
Hmm.
common. The first and second degree ligament injury can be treated in physiotherapy, but the third degree ligament injury with the meniscus has
Hmm.
to be operated by an orthopedician. And the lower
I see.
limb injuries usually takes about 6 to 8 weeks to recover. So it's the
Hmm.
long time that you are away from the resistance training. So
Okay.
that will lead muscle atrophy, and you
Yeah.
might require lot of time immobilization.
Okay. And also,
So
being overweight also could be an issue, causing all the knee issues and things like that, right?
overweight doesn't cause much of the injuries. It's
Okay.
usually in females who have wider pelvis. They have lot of genu valgum, that is bowing of the knees like this. That
Okay.
time the ACL ligaments get stretched too much.
Oh,
That's
okay.
the cause of near ACL ligament injuries.
Mm-hmm.
Sudden
So,
cracking sound you will feel, or you see sudden buckling of the knees. So you should
mhm,
get and checked with the orthopedician.
right. So initially, perhaps if then they're starting to train, they might have aches and pains. Should they quickly come to the doctor at that point, or can they do some mobility workouts and
It's
then
okay to
perhaps?
do mobility workouts when you have aches and pains. Aches and pains are very common. So
Yeah.
I feel they should do a lot of stretching exercise before starting any technique or anything. Because if you're not stretching properly, not doing proper warm up, and the beginners are starting workout and lifting heavy weights directly, you will enjoy yourself. So
Right.
I feel stretching is very important while doing a workout.
Okay.
So
Uh,
even for the
yeah.
quadriceps stretching or shoulder stretching, everything you should be stretched properly, and then you have to start the workout.
Got it. Got it. Got it. And all the injuries, are they curable, or are there any like permanent injuries that people have which
There is no
that,
permanent injury. It is curable. Everything is curable. Only that if you're not taking a physiotherapy treatment in that period of time, it will
mm,
remain. That pain will remain because you're just immobilizing yourself and staying at home. You're not going for any exercise. There is something called a mat exercise. Even if you are at home, you should do a little bit of mat exercise, that is straight leg raising,
okay,
activating your quads. So that time the muscle will not go into atrophy. So
right,
yeah, so you should be going to a physiotherapy in that immobilizing period and avoid muscle atrophy so that you can go
atrophy
faster
means
back to the
declining
resistance
of
training.
the muscle
Yeah,
mass.
muscle.
Atrophy,
Yeah,
yeah.
yeah,
Got it. So there's always some basic exercises that you can do even when you're
yeah.
having some
You
injury.
shouldn't be lying down simply. Oh, I have injured myself. Let me lie down and take rest. So you should
Mm,
be doing some kind of exercise for it. And there is always an alternative if you're
yeah.
like a TRX training. It offloads
Yes.
some of the muscles and allows you to do some workout. If you can't do a
Exactly.
squat, that
Yeah.
TRX will take your body weight and you can do some other part of the body exercise.
Exactly.
Yeah.
So yeah, so if you've had knee pains, you can avoid jumps and use the TRX straps to hold the weight. Especially at
Yes.
Breakthrough Studio, we only use the original straps, which can take
Yes.
up to 154 kg, and
Yes.
a lot of them, they do benefit from TRX workout. Yeah,
Right.
and not only that, you're working multiple muscle groups with
Yes.
suspension training. So yes, you might not get, if your knees are injured, you may not be doing jumps, but you're engaging other muscle groups like your arms, your core, your glutes. So you're still burning a lot of calories. So
Calories.
that's
Yeah.
one thing that the viewers can try. Even if you are injured, do come and try the workouts. And
Yeah.
our just wanted to add that our coaches are certified coaches, so there's no what called risk in um, doing the wrong technique as such, because they constantly monitor you. Our groups are very small, about 10 in a group, and they're constantly monitoring you. Schedule is given, you're not let by yourself to do the workout, so the chances of injury is less. So yeah, so that's just wanted to add that. And yeah, what about women over 40? Are they, like you're saying, yes, they naturally have that hip movement, which causes strain on the knees, right?
Yes.
So besides that, as estrogen levels decline, with age, those thing factors also affect cause any injury. What do you have to say
Yeah.
about that?
Yeah. Estrogen affects the bone density. But
Mhm.
I feel sometimes resistance training should be incorporated after 40 because as you age, your muscles go into atrophy and you have to rebuild your strength. So after 40, you have to do a resistance training. If you don't do resistance training, you won't have that bone mass density also. You will be lacking somewhere. So
Mm.
I feel after 40, you have to start more of resistance training
Yes,
because
exactly.
it will improve your mood, improve your estrogen levels, and actually it will improve your estrogen levels, and there will be less stress factor to your bones. So I think resistance training should be incorporated after 40.
That's very nice to
Yeah,
know and hear from you.
yeah.
Yeah, I mean, I firmly believe that you can be a lot stronger in your 40s than you were in your 20s,
30s.
if you just focus and prioritize, because a lot
Yes,
of us, we just don't prioritize with age.
yes,
But
yes.
yeah, if you
But
do
I think like
prioritize.
a proper workout regime should be followed. Like one day, if you're doing an upper body or
mm,
some of the muscle groups, you should give
yeah,
a 48 hours of rest. And then you have to jump into the other muscle group. So
right,
continuously, if you're repeatedly doing the same muscle group daily,
that's
so you
right.
will enjoy yourself once.
Correct, correct. So that's
So
why
there
we
should be
have
a
like
strict training.
Mondays.
Yeah.
Yeah, that's why we have Monday, we do leg and core. Tuesday we do Pilates, which is like flexibility, focusing on flexibility. Wednesday we do a bit more cardio overall, and then Thursday we do upper body and core. So, and then Friday a little bit more strength with the kettlebells and TRX. So we give the clients a nice mix, so that the body rests. Although some of them are very eager to, push, push, push every day. I
Yeah.
keep telling them, no, you got to, it's good to mix it
Muscle
up.
recovery.
Good,
Yeah.
its breaks are good. It's not about just going all out one day and then not doing anything another, couple of days. It is breaks are good, are essential as well, to give your body that break to recovery for muscle repair and
Yeah.
building. Yeah. So yeah, that's what. Um, and So you were saying to do a good warm up,
Yeah.
and you suggest stretches before the workout or after the workout? Um,
After the workout, usually. It's
After the
after the
workout.
workout.
Yeah,
Yeah.
yeah. And what kind of duration do you suggest for a warm up and for stretches
Usually for a
for a
warm up,
50
it
minute
would be
workout?
around 15 minutes of warm up,
Okay,
then actual resistance training about 20 to 30 minutes, and then a
okay,
cool down. That is the stretching part.
yeah, okay,
So cool down is always necessary. Some people don't do it. They just do the
yeah,
resistance training and just leave the studio
yeah,
sometimes. So
yeah,
it is very necessary. Next day when you come, you will have soreness. That is because of the you're not done a stretch.
yeah, yeah. They want to feel the soreness, some of them. Is that a
Yeah.
good thing to like keep
Yeah, it is
feeling
a
so
good
all
thing.
the time?
It's a good thing, but I feel sometimes you have more soreness and tiredness because your intake also won't be a proper thing. Like some people don't have protein in their diet.
Right. Yeah.
So sometimes they feel more tired, I feel,
Mm.
initially, beginners. So
Mm.
we have to tell them that also diet is also equally important.
Got
So
it. What do you recommend, like as a pre-workout, post-workout? What do you
I think
recommend?
pre-workout meal is also important, like a banana or an apple or something, which gives you
Okay.
an energy, not in an empty stomach to do any workouts. And post-workout is any of the shakes or I think any proteins which you
Protein.
can
Yeah.
recommend.
Mm.
Uh, that is very important.
Yeah. Some of them
Yeah,
have a proper Indian breakfast and do a workout, and they have adverse effects. So I suggest it has to be pretty light, your pre-workout,
yeah,
and about 2 hour gap is required, right, before
yeah. You
before the
can't
workout.
have a full stomach and do a workout. I
That's
don't
for
think
sure.
so.
I mean, I
Early morning
prefer,
workout. Yeah, early
yes,
morning workout is always preferable. That's early morning, like a 5:30.
yeah.
You should start your
Mm.
workout
Yeah, I do on
because
empty stomach mostly
even I
because
do
I
an
like to
empty stomach.
fasted, yeah, and just
Yeah,
hydrate well,
yeah,
simply because it does burn more fat. But people who are not used to it, I suppose very light, light snack would be helpful. And then for recovery, the amount of protein that you consume. What do you suggest the amount of protein they need to consume so that they recover well?
Uh, initially, I think it's like 20 gram or because you're not stressing too much your muscles or a 90
Okay,
gram proteins.
okay,
Later, you
okay,
can ask your gym instructor and increase the protein intake because if you're not doing too much and you're taking too much of protein, that wouldn't have an effect on your resistance training. So if your
yeah,
intake is also too much, then you're not burning too
yeah,
much, not building too much
yeah.
of the muscle. Yeah.
Got it, got it, got it. Okay. Mm, and if you can discuss one or two cases which happened due to a wrong workout or due to some sports, how do you manage that? For example, when you're doing sports, you're only using one side for badminton, and they tend to injure that side. So how do you suggest, people should work out for that?
It is usually uh, one side is usually because you're doing that side of the right hand is dominant. You're
Mm,
using that side. That's why it has injured. So when
mm,
they are doing in the for before the doing any badminton, they will be training themselves, the
mm,
athletes. So they will be training the both the sides of the arms. It is not the only one side of the arm which they train. So both the sides of the arm will be trained. So when you have injured yourself, even the right arm will be giving the treatment, but the left arm will be involved because the scapula, both the sides, the muscles are involved. So we usually concentrate more on the scapula back muscles for the badminton player, not only
mm,
the shoulder.
mm. So it's not like you have to work out the other half of your body more than the one which is used, right?
No,
Do you
no,
have to
nothing.
do training like
Equally,
that?
equally.
Equally, you need to train.
Yeah.
Okay. And yeah, any other examples that you can think of where there have been injuries?
There are
Um,
many types of injuries which are happening, like in cricketers while throwing the ball, they have shoulder injury.
mm,
It's called a Hill-Sachs lesion or a Bankhart's lesion. The shoulder
mm,
gets torn from the shoulder joint. So
mm,
they do usually an arthroscopy surgery for it. One and
mm,
two can be managed by physiotherapy. More than level 2, then you have to undergo an operation. And after
mm,
the operation also, they have to immediately undergo physiotherapy. Like around only one week of rest or 2 week of rest, they come back to physiotherapy. So
before
now
you do
it's
a
called
workout.
arthroscopy surgery. Yeah. So it
Mm,
is very easily done and less invasive. They won't
mm,
get a big cut here. It's just a keyhole surgery,
okay.
so it can be done very easily, and the athletes they come back to recovery very soon. Like the recovery phase, we start within after 4 days. We start all the recovery exercises like scapular exercises, back exercises. Then we concentrate on the shoulder. So not like before. Now everything is advanced. Like meniscal surgery also is a keyhole surgery. ACL
Mm,
surgeries are also keyhole surgeries. So
okay.
everything can be repaired nowadays. It's not like a permanent injury to anyone. So
Okay.
everything, even the
Do
reconstructive surgery.
uh, like at the studio we do quite a bit of like rotational movements, etc. Do you think that will be helpful overall?
Yeah,
Like,
it will be
mm,
helpful.
uh,
Yeah,
yeah,
rotational
we
movement.
do in different dimensions.
Oh,
The how you train
like
the
this
body is like
one,
360
this
degrees.
rotation.
Yes,
Kind of
exactly, exactly.
rotation. Okay.
Yeah,
That will
yeah,
be helpful. Yes, yes, that will be helpful because you're involving the core muscles, because core
yeah.
muscles are indirectly connected to the shoulder joint. So
Got it.
anything which you're doing, rotational obliques and all, obliques are
Yeah.
also very connected to your shoulder joint. So you have to, whole body is a fascia. Fascia means it's connected to each other. So
Yes.
anything, if you incorporate your core or the lower body, the shoulder joint gets repaired with that.
Awesome, awesome. It's all
Yeah,
connected. Hmm.
yeah.
Nice.
So one more point, like a shoulder joint, if you're continuously doing a resistance training for at least 2 weeks, you will build up the muscle strength easily.
Exactly.
Yeah,
Yeah.
but the lower limb takes time.
Okay, okay, okay.
Yeah,
Your legs take time
take
compared to
time,
your shoulder.
but the shoulder takes easily the load.
Okay. Hmm. Yeah, I remember when I was doing, like contemporary dancing, we used to
Yeah,
do a lot of movement, like take weight on the shoulder. So the
yes.
instructor kept saying it's quite sturdy compared to any other body part.
But
Yeah. Okay. So anything you want to tell people who have, just got injured for any reason? Um, what would the first advice that you give them? What would be the first thing that they should do?
First thing is rest for some time,
Okay.
like
Mm.
at least 172 hours of rest if you're injured.
Okay.
Then icing, then compression, then elevate
Mm.
your leg and sleep. Then you have to
Okay.
visit the doctor within 2 days, take an
Okay.
appointment and visit. If the doctor says something like an MRI, please get it done. Don't neglect it.
Okay.
Because sometimes the level of injuries we don't know while we examine. If it is too much, then the medicines don't work out. So please
Mm.
get it checked. And then
Okay.
in that period, please don't strain yourself and go back to workout because you're tearing the muscle more, ligaments more, and
Got it.
that will show up. So,
Right. So
yeah,
rice is what? Rest,
ice,
ice, and then
compression, and
compression,
elevation.
elevation. Okay, got it.
Yeah.
Got it.
Compression is through
Okay.
that crepe bandage, crepe bandage.
Okay. You can do it
But
at
for
home.
the shoulder joint, you can't put a crepe bandage. For the
Got it.
knee
Got it.
joint, you can put a crepe
Yeah.
bandage. For the ankle, you can put a crepe bandage.
Okay. So
For the
all needs to
shoulder,
be done like one after the other.
one after the other. In one day
Mm.
itself.
Okay. Okay. Got
Okay.
it. Got it. Okay. And so, what
So,
about like going to a chiropractor compared to like for injuries?
chiropractors, they usually deal with only the bones. They don't deal with the muscles and the fascia
Okay.
and everything. It's
Got it.
recently in India it has come up. But if
Mm.
you're going directly to a chiropractor, he won't examine what has happened. He will just do the tuck, 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 tuck movement and give you back everything. Sometimes it doesn't solve. So
Right.
I am not too chiropractor. So you have to
Mm.
go through a normal route. That's meet a
Physio.
doctor, and then if the doctor suggests you to go to chiropractor, I feel you should go. Otherwise,
I guess
you
they
should
give temporary relief. They don't
relief.
get to the
Yeah,
root
you
of
will
the problem.
again your joint will go back to that shape because the muscles are pulling. So
Okay.
yeah,
Mm.
you can't correct the bone outside. I feel
Mm.
you can't do
Got it.
simply. It's only the
Yeah.
vacuum which is releasing. So
Mm-hmm.
the muscles will anyways pull back the bones. So I don't think so that relief will be there.
Got it. So, I mean, best is obviously prevent getting there, prevent injuring yourself by, having a good warm up routine, stretching, and good nutrition. Starting, scale down and then working yourself up. I guess is the best way because you've got to just try to prevent this first, right? But if you do get any injury, Dr. Anchita is there. Please you can contact her on Instagram. I will share the details below, and yeah, she will be more than happy to help you all. So yeah, thank you very much, doctor. I think that was very useful for our viewers,
Yeah, thank
and yeah, thank you so much for your time, and
thank
thank you all for watching us today.
yeah. Thank you very much.
Thank you.
I hope
Thank
the information was useful for you.
you. I'm sure it was for all of us. Thank you. Have a good day.
Thank you. Thank you. Thank you.